This morning, be aware but not afraid and plug your nose. That's advice from doctors for anyone swimming in freshwater lakes, ponds, and rivers. A rare brain infection has killed a Georgia resident who was likely swimming in a lake, and doctors say an amoeba that lives in warm, fresh water is to blame. Here's John Schierick.
The Georgia Department of Public Health is not naming the body of fresh water where the victim was likely infected, saying that every lake, pond, and river everywhere carries the same risk, a small risk, of hosting the amoeba. And there is no environmental test for it. It affects only humans, not animals. And there is no cure if you're infected. The amoeba is called Naegleria fowleri, and if it is in the water, it would enter through the nose, and that's the only way someone can be infected.
It cannot infect an individual by swallowing water.
Dr. Sherry Drenzik
It cannot get in through open cuts.
Is the state epidemiologist with the Georgia Department of Public Health.
We do not find this particular amoeba in salt water, and we also do not find it in properly treated swimming pools and drinking water either.
I love you.
And Dr. Drenzik says out of 160 known infections in the U.S. in the past 60 years, an average of about 3 a year, all but 4 of them were fatal. CDC epidemiologist Julia Haston.
Your risk is very, very low of actually getting the infection, but we can lower it even further by doing things like avoiding submerging your head in fresh water or using nose clips or holding your nose when you're swimming this summer.
The amoeba killed an 11-year-old child at a city-run splash pad in Arlington, Texas in 2019. And the city later discovered that the chlorine levels in the water had fallen below minimum requirement.
Now, this latest death in Georgia is the 6th one in the state since 1962.